States share a state line with Arkansas, and recently all 6 of those states have elected to change the Medicaid benefit for postpartum care from 60 days to 12 months. Arkansas is the only state in the country that doesn't plan to do so. Chris Bryant took a look at the numbers and what it means for postpartum care in the state.
Whenever we have a woman come in for postpartum care, we're assessing whether or not there was something that went on with the pregnancy that might impact her life.
The Kaiser Family Foundation says that 4 in 10 births in the United States is financed by Medicaid. Right now, Medicaid covers 60 days of postpartum care.
Also know that it's also a very vulnerable time for infants and making sure that our infants are well taken care of and they have a good life.
When it comes to mothers, postpartum care plans should happen before the birth of a child. Postpartum care continues after birth as well.
Testing modalities that we can give to assess how well a woman is doing, emotionally speaking, depression, whether or not we're worried that, postpartum psychoses may be occurring.
According to the Arkansas Advocates for Children and Families, between 2013 and 2017, the maternal mortality rate in Arkansas was 44.5 deaths per 100,000 live births. The average in the United States was 29.6 deaths for every 100,000 live births.
If you have a center, a tertiary care center where these patients' needs can be met, then their outcomes are much better than if you're in a rural place where you can't get the care that you need.
Northwest Arkansas has a maternal mortality rate of 53.4%. Northeast Arkansas at 33.4, Southwest at 63.1, and Southeast Arkansas at 53.6 per 100,000.
22% of them happened in that 7 to 42 day mark. From 43 to 365 days, it went up to 33.9.
Through the American Rescue Plan Act, states could opt to change coverage from 60 days to 12 months.
I would like to see the state expand to a full 12 months, and it's not a radical idea.
Little Rock State Representative Ashley Hudson said this spring that she was in favor of anything that helps mothers.
I'm in favor of anything that helps mothers and babies, and I hope it works. The problem is that we know that 60 days postpartum is a really terrible time to lose your health care coverage.
I do know that coverage exists. We want to make sure every woman has coverage, and that is currently available in Arkansas. But again, coverage does not equal health care. We have to make sure that these women are actually going and seeing a doctor.
Arkansas Governor Sarah Huckabee Sanders said services are already in place. It's just a matter of getting them to those in need.
Our state agencies will take immediate steps to enroll all eligible women in the programs that we already have that are available. Too many women simply don't know about the resources we offer.
Arkansas Advocates for Children and Families says that in 2019, Arkansas ranked 48th when it comes to overall health in women and children. In Springfield, Chris Bryant, KY3 News.